Hello, my name is Tabish, and today we are going to explore the fascinating world of anesthesia machines. Let's jump right in. Slide 1, Title Slide. Title: The Working Principle Behind Anesthesia Machines. Overview: The slide briefly states that anesthesia machines are crucial in modern healthcare for delivering controlled mixtures of gases and medications during surgery, ensuring minimal discomfort for patients. Slide 2, Introduction to Anesthesia Machines. 1. Delivering precise gas mixtures. Anesthesia workstations deliver exact mixtures of anesthetic gases like nitrous oxide, oxygen, and volatile anesthetics. This ensures proper sedation and analgesia for the patient. 2. Primary components. An anesthesia workstation includes the anesthesia machine, a ventilator, a breathing system, and a waste gas disposal system. These components work together to deliver gases, manage ventilation, and eliminate waste gases. 3. Ensuring patient safety and comfort. Anesthesia machines are critical for patient safety and comfort. They allow for precise gas delivery and continuous monitoring of vital signs to manage the patient's condition effectively. Let me help you identify the parts of an anesthesia machine labeled here and give you a brief description of each. 1. System switch. A master switch that powers the anesthesia machine on or off, controlling the operation of the entire system. 2. Vaporizers. Devices that convert liquid anesthetic agents into vapor so they can be mixed with gases like oxygen and delivered to the patient at controlled concentrations. 3. Flow meters. Devices that measure and regulate the flow rate of gases, example oxygen, nitrous oxide, delivered to the patient. Each gas has a separate flow meter, often color-coded for easy identification. 4. Auxiliary O2 flow meter. A backup oxygen source that can be manually controlled, allowing the anesthesiologist to deliver oxygen directly to the patient if needed, independent of the primary system. 5. Display. A screen or set of indicators that provide real-time information on various parameters, such as gas flow rates, pressure levels, and other vital system statuses. 6. Suction regulator. Controls the strength of the suction used to clear the patient's airway of fluids, blood, or secretions during surgery, ensuring a clear airway. 7. Bellows assembly. Part of the ventilator system that physically moves to simulate the patient's breathing, ensuring that the lungs receive the correct volume of air and anesthetic gases. 8. Flow controls. Knobs or levers used by the anesthesiologist to adjust the flow rate of gases delivered to the patient, allowing precise control over the anesthesia levels. 9. Rebreathing bag. A flexible bag used in the breathing circuit that allows the patient to rebreathe some of the exhaled gases mixed with fresh gas. This helps to conserve anesthetic gases and maintain respiratory function. 10. Carbon dioxide, CO2 absorber. A device containing chemicals that absorb CO2 from the exhaled gases in a rebreathing system, allowing the cleaned gas to be reused in the breathing circuit. 11. Breathing system. The entire setup that connects the anesthesia machine to the patient, including the breathing circuit, valves, and filters, which facilitate the delivery and removal of gases. 12. Oxygen, O2, flush button. A button that delivers a high flow of 100% oxygen directly into the breathing system, bypassing the vaporizers. This is used to rapidly increase the oxygen concentration in emergencies. 13. Brake. A mechanism used to lock the anesthesia machine in place, preventing it from moving during surgery and ensuring it remains stable. 14. Primary gas supply gauges, usually pipeline. Gauges that display the pressure of gases supplied from the hospital's central pipeline system. These ensure that the gases are being delivered at the correct pressure. 15. Secondary gas supply pressure gauges, cylinder gauges. Gauges that monitor the pressure of gases supplied from backup cylinders, ensuring there is sufficient pressure for use if the primary gas supply fails. Slide 3. Core components of anesthesia workstations. Anesthesia machine. The central component, responsible for delivering anesthetic gases at specific concentrations using features like flow meters, vaporizers, and pressure regulators. Ventilator. Supports or controls the patient's breathing by delivering oxygen and removing carbon dioxide, ensuring proper ventilation. Breathing system. Connects the anesthesia machine to the patient, including components like a breathing circuit, mask or endotracheal tube, and a humidifier to facilitate gas exchange. Slide 4. Additional components of the workstation. Drug delivery system. Administers intravenous anesthetic drugs like propofol or fentanyl for added sedation and pain relief, typically through a syringe pump with a monitoring system. Suction equipment. Essential for clearing the airway of fluids, blood, and secretions during surgery to maintain a clear airway and ensure proper ventilation. Data management system. Integrates patient monitoring data, example heart rate, blood pressure, oxygen saturation, with the anesthesia machine to provide real-time information for informed decision-making. Slide 5. The evolution of anesthesia machines. 1. Early devices. Initially, anesthesia machines were simple inhalers offering limited control over gas concentrations. 2. Progression. Machines evolved to include multiple anesthetic agents with better control, and portable versions were developed for field use. 3. Key milestones. Advances in engineering and technology led to modern, sophisticated anesthesia machines with innovative features. Slide 6. The Boyle's machine, a milestone in anesthesia. 1. Inventor. Henry Edmund Gaskin Boyle invented the Boyle's machine, which significantly advanced anesthesia technology. 2. Integration of high-pressure gas supplies. The Boyle's machine introduced high-pressure gas supplies, improving the reliability and efficiency of anesthetic gas delivery. 3. Impact on future designs. Innovations in the Boyle's machine, like flow meters, vaporizers, and a gas-driven ventilator, influenced future designs and laid the groundwork for modern anesthesia machines. Slide 7. Critical safety mechanisms in modern anesthesia machines. Alarms. Modern machines have alarms to monitor oxygen levels, gas flow, pressure, and other parameters, alerting anesthesiologists to potential issues for timely intervention. Fail-safe systems. These systems automatically cut off gas flow or adjust mixtures if unsafe conditions are detected, reducing the risk of complications. Redundancy. Many machines have backup systems to ensure continuous operation even if a primary system fails, adding an extra layer of safety. Slide 8. Practical operation of anesthesia machines. Pre-operation checks. Before surgery, the anesthesiologist conducts checks to ensure all systems function correctly and that gas supplies are adequate. Setting up. The anesthesiologist selects appropriate gas mixtures, ventilator settings, and monitoring parameters based on the patient's condition and the procedure. Monitoring and adjustments. Continuous monitoring of the patient's vital signs during surgery allows for real-time adjustments to anesthesia machine settings to maintain optimal anesthesia levels and ensure safety. Slide 9. Integration and future developments. Integration with patient care systems. Modern workstations are increasingly integrated with patient monitoring and data management systems, providing a comprehensive view of the patient's status. AI and automation. Future advancements may include AI-driven monitoring systems that analyze patient data in real time, improving safety. Improved interfaces. Future machines may feature more intuitive interfaces and advanced decision support systems, enhancing the anesthesiologist's ability to manage anesthesia effectively. Slide 10. Conclusion. 1. Summary. The presentation reviewed the evolution, key components, safety features, and future trends of anesthesia machines, highlighting their crucial role in surgery. 2. Importance. Anesthesia machines are vital for patient safety and comfort, enabling precise control over gas delivery and continuous monitoring of vital signs. 3. Future outlook. Future advancements may include AI-driven monitoring, automated adjustments, and user-friendly interfaces, promising safer and more comfortable surgical experiences. Congratulations! You have now known about basics of the anesthesia machine. Thank you for joining me. Subscribe to our channel, Tabish Akhtar Live, and get 1% better each day. Stay safe and keep learning.